philanthropist, Chief Dr. Chetachi Dikko is set to assist Nigerians in the aspect of humanity and taking care of their health. I want to find out from her what has led to this and how. Join me and let's see how things will go from here. On live to GTV Africa, and right now I'm with High Chief, who is set to take care of Nigerians in times of health. She's going to explain the aspects where she's going to assist Nigerians. And I want her to take me around to show me those things that she has prepared for Nigerians to see. Join me as we move around and I question her. She's going to talk to you soon. This is GTV Africa live from Abuja.
As you guys can see, this is just not even all the eyeglasses we have. We actually budgeted about maybe 1,000 or more than 1,000 glasses. All right? So this, what you see here, is just not even it. All right? So as time goes on, they bring more glasses out. But we have over 1,000 or more glasses. All right? And we have some with prescriptions, and we have some for reading as well.
How many glasses can one person get?
One, you can only get one at a time. You need one reading glasses, and that's what you will get. If you need prescription, you get one prescription. Remember now that everything is for free. My name is Chief Dr. Chetachi Dikko.
Today you seems to be assisting Nigerians an aspect of medical. Why are you doing that?
Well, it's my passion. I love to help people out. And doing this medical mission will save a lot of lives, and that's what I'm all about. I'm all about saving lives. And if you can see the motto here, it says restoring hope. And when you look over here, you will see every life matters. And the When in Need Foundation, that's what we're all about. We're all about the people and helping the poor masses in Nigeria.
How long have you started this?
I've been doing this for over 20 years right now.
20 years?
Yes, I've been doing
What
this
inspires this?
myself, and the promise that I made that if God blesses me, that I will continue to bless others and everyone that I can bless. So it's a promise that I made. It's a convention that I have within my heart. So I have to do it. It's a promise I made, and I must keep my promise. My word is my word.
Like how many people are we looking at this time around?
You mean today?
For today?
Let me tell you, if we're able to help 200, 300 people today with free medical treatment, that is the consultation with the doctors, evaluation of whatever that is wrong, diagnosing the sicknesses or the illnesses, and giving them the medications for free, then I've accomplished a lot today. I will go home, I'll rest happy that I helped 300 people today.
I think I need to be part of those 300 people.
Yes, then we'll have 301.
That's Ma, how much have you budgeted for this?
I can't tell you that. That's private. All I can tell you is that I use my personal finances to fund this. And then I have the Order of St. George, who has been helping us for quite some time right now. I am a dame in the Order of St. George. And if I call them up and tell them, please, we need antibiotics or we need eye drops, they will source all these things out for us.
So why have you not been doing this before now?
I've told you I've been doing this for a long time.
Okay, let me find out.
Yes.
I want to digress a little.
Yes.
Sometimes ago, you promised some communities, villages, and traditional rulers
Yes.
that you are going to give them
Seedlings.
seedlings.
Yes.
How far have you gone about that?
Oh, we're collecting all the seedlings right now. It's about 24 or 26 rulers that came. So it's not easy to serve all of them. Most of them that wanted yams have gotten their tubers of yams. So you can imagine empowering maybe, I don't know, how many royals with maybe 50 or 60,000 tubers of yams. So you can imagine that.
Now, coming back to this environment, are you likely to go to villages to restore their pets too.
You see, this is what we do. When we're like in about 26 states or 29 states right now. Our coordinators are there on ground. If we get a need that a community needs medical mission, then we will do assessment. And then within that assessment, we will know what they really need. If they are suffering more of this or that, then we'll know how to assist that community. And also, people here reach us in United States. On our website, the When in Need Foundation website, there is a link that you can click and you can tell us what your needs are and how we can help you. And then we'll go from there. And then we'll send someone here in Nigeria to go to that community and do assessment of what the needs are.
So, today, you've started. How many days are we looking at? Only a day or how many days?
You know, it depends on how many people we serve today. As I told the pharmacists that if we do not finish giving out what we have today, then we have to come back and do it again in 2 weeks or 3 weeks time. Before I go back to United States, we have to do it again. You know, because the idea is to make sure that we give away what we have. There is no need storing it. Even though this is a hospital, we will have enough for people that are coming to take care of themselves that can pay. We'll have enough for them. But we need to make sure that we serve more of the people that really needs help. Now, there are 3 categories of people we serve. We serve the elites that have money to pay. This is a well-equipped hospital. I'm not sure if you know that. There is nothing that is not in this hospital. This hospital may look small, but it's a huge hospital. The theater is so beautiful. The labor room is so beautiful. I mean, you have to see our lab. There is no lab equipment that we do not have. Name any lab equipment, we have it here. We have x-ray machines here. There's really nothing that a bigger hospital we have that we don't have here. So the elites that have the money that needs good care, they can come here too. Then we also serve the individuals that doesn't have the capacity to pay the full amount. So we allow them to pay as much as they can afford to pay. Then we have those that really don't have any money at all, that cannot afford anything. We serve them as well. They can come, they don't need to buy any card, they don't need to pay to see the doctor, they don't need any of those. They can come and they will be helped because this is also about humanity.
It's like I shouldn't allow you to go. But I want you to take me around some of those things that you prepare for Nigerians. But on behalf of Nigerians, may I plead that you extend the days? You
know, this is yes. I will extend it to next week or next 2 weeks so that people can come, more people can come. But I can't take you all over because this is a hospital.
Only this
side, yeah, because this is a hospital. You can only see the reception and all that, but this is a real hospital, so I can't, and not everybody can move in and move out because we also have to protect the health of others.
Your name again?
Dr. Chetachi Ekton, Dr. Chetachi Ekton Dikko. I'm forgetting the chief.
Hi, Chief.
Hi, Chief.
Today I'm one of the beneficiaries of the blessings. So I'm very happy to be here today and also to be a partaker of what you have been doing. So I appreciate you. May God bless you more. Please, I want to use the opportunity to ask for one favor again because my case is a severe case. Thank God I've gotten some medications, but from the last lab I went to, it was a spinal cord injury. So what I have went to MRI test, they say I should go for surgery, but I don't have money for the surgery. So it was last week that I posted my concern on social media, and somebody directed me to this place today. So please, man, I'm pleading for help, man. If there's any other area I can help me to walk again. This is 2 years now, I'm beyond this wheelchair. Even this wheelchair is the church. I don't even have wheelchair. This is hospital old. Anywhere I want to go to a church program or go to anywhere, I want and borrow wheelchair. So please, ma. That's all I can say.
I've heard you, and I will take your name,
Yes, ma.
and then I'll see what I can do.
Okay, ma.
You know, I'm only one person.
Yes, ma.
I don't have any funding source coming from anywhere. There's nobody giving me money for anything.
And God is your source.
You know, as I said, that if God blesses me, I'll bless someone. So as you can see, God has blessed me, and I'm blessing a lot of people today.
Amen.
So I will take your name, and we'll take everything you have said right now into consideration, and then we'll get back to you and see how we can help you out.
Okay, ma.
Okay?
Thank you, ma.
And you said you don't have any wheelchair.
Yes, ma. Yes, ma.
So how is it for 2 years? No wheelchair
Yeah,
for 2
the
years.
case started 2 years ago, but when I stopped walking or to stand there again, it was October last year.
October last year.
Yes, sir. Yes, ma.
And you have not been able to get a wheelchair.
I have not been able to get wheelchair, ma. In fact, my aim be said by now I have been able to move. So I don't even know that I will stay up to this moment without getting myself back to fit again.
All right, we'll see what we can do. We'll get all your information. But I'm glad that you saw the doctor today and you have gotten some medication.
Yes, ma. Yes, ma.
Thank you so much.
God bless you, ma.
Thank you.
Thank you so much.